Welcome to the CX Matters podcast, a production of the American Journal of Healthcare Strategy, with your host, Cole Lyons.
Hello, everyone. This is Cole from the CX Matters podcast. I'm joined by Vishal of Advocate Health. Vishal, please introduce yourself and your role.
Absolutely. Pleasure to be here. Vishal Bhalla, I'm the Chief Experience Officer at Advocate Health. I have the pleasure of working for an organization that sees the vision of, and senior leadership, of course, sees the vision of pulling the entire human experience under one umbrella so we can look at the end to end journey, especially in healthcare, of our patients and, of course, our teammates. I say those who serve and those we serve. So, as you may know, Advocate Health also has not only the whole continuum of healthcare delivery, but also Wake Forest University and health system. So we have the pleasure of being able to also collaborate with the academic side, the the learners and the faculty.
It's a very large organization now, right? Now that it encompasses Atrium and Advocate, Aurora, I believe, is up there in the Illinois area. So, can you just give us a quick snapshot of the scale? Off the top of your head, how many employees and patients are you working with?
Yeah, we have just under 160,000 teammates, and just over 6 million patient uh, unique patients. We are now in 6 states, and about 30 billion in revenue. We say we're slightly bigger than Starbucks, I believe.
Wow, that is just incredible. That's the scale of that is amazing. We're so honored to have you on to share your insights with our audience because it's such a unique position that you're coming from, and you also have very unique ideas. I want to go back to when you got your MBA at MIT, right? It's a renowned institution. Their MBA graduates go on to do some really incredible things. So at that time, you could have probably done pretty much anything you wanted to. Why did you go into patient experience? How did you get there?
Yeah. So first of all, I don't know how I got into MIT. I think that I was just lucky. Uh, what one of the classes they have is on leadership by Professor Deborah Alcona, and she helps you, um, each of us, really reflect on what we bring to the table, so to speak, figuratively, and how best we can be principled leaders who would make a difference, and how best to apply what you bring to the table. Kind of like the concept of ikigai, but very intense. It was a very emotional class for me personally, and I was going through a lot of personal crucible moments, if you will. My dad was in hospital uh, for about last 2 years of his life, and he was, a year past into that, and I decided, because I was spending 20 days on at work and 10 days at home, spending time with him for 10 days a month straight, and then decided to serve in healthcare after he had passed, because with my education at MIT, where I really focused in on system dynamics, and I'm a master black belt in lean and some experience in hospitality, as you know, on the people side. And I'm a bit of a data nerd as well. Thought that I would be able to apply my skill set to make a difference. Because what I found in healthcare is, while every individual was really connected to taking care of the patient, our systems and processes were a bit of a hindrance.
What processes did you see at the time, right, back then that you saw were a hindrance, if you don't mind being specific?
Uh, yeah, I think I'll give you an example. Is something occurred with my dad, which was due to probably lack of staffing.
Hmm.
I'm just presuming from one side of the one-way mirror, right? I have no idea what occurs behind as a patient at that time, especially. And so I pushed my way up the chain of command, gently but firmly, to try to find out how or why could something like this happen. And the response was lack of resources, right? We were not fully resourced. And my response to the COO at the time was, ma'am, respectfully, you have water running down the drain on this side and people dying thirsty on the other. So it's about really the systems and the process. I say in healthcare, people are who serve are so connected with the patient. They're like this beautiful bird who wants that cake, right?
Mm.
That's their purpose, is to serve the patient, and they will sacrifice themselves and their family time, even their personal health, to get to that cake. What do we as a society, that includes the various agencies and admin administration, do? We put a glass cover over the cake.
Yep.
So the bird is so driven that once the cake, it will whack its beak and whack its beak. It will bleed.
Yeah.
Some will die. Some will learn to fly around and get the cake, and then they get their knuckles wrapped. Right? So what we need to do is lift the glass and really, uh, that that is what I find in healthcare. Is to help lift the glass and let people connect back to their purpose. Because the moral purpose of the people who are serving and people we are serving is aligned, then the patient gets better.
Good. I appreciate that illustration very much. How did you begin implementing what you had saw and what you had, what you had learned at MIT? What was some of the first kind of roles that you took on where you started to implement these skills?
So, as an institution, one of the things that it really helped us do is learn frameworks and learn to build frameworks that we can go out and apply. And listening, of course, is key, right? Go out and assess. So when I joined, I was really lucky to have worked at Parkland in Dallas, which is a system that really serves everyone and truly serves everyone. And what I learned, while my intention was to serve patients, what I quickly saw is how people who serve are hurting themselves and the amount of burnout, and so we really needed to work on the teammate and clinician engagement and experience. More than engagement, they're engaged, but their experience, really lift that up before we could do the patient experience, and then leverage data to really focus in on what was most important using a system dynamics approach. And then basically you look at, use surveys and focus groups to which everybody does, and then drill down on the key variables and identify at what point do you invest in this variable for what output. And then at some point you start getting to diminishing returns, right? Then you have to go to the next most important driver, if you will. And so we built that for both clinician and teammate experience and then patient experience, and really moved the needle at Parkland, and now doing that at a larger scale across the enterprise. The one other thing I would say, and imagine a loaf of bread, if you will, and various slices of the loaf. And in healthcare, we are organized just like that. Each vertical is a specialization, and very rightly so. And we have to innovate in that specialization. And the patient, imagine now, is a baby spaceship, like a capsule. The patient is in it, flying through the various slices of bread. And as we innovate and improve our process, what happens is that the pores in the bread get misaligned, right? We're doing it for the right reasons. Everyone is driven for the right reasons, but our systems and processes get slightly misaligned. And so that capsule gets stuck in between slices of bread. And what the teammate then is doing, because they're driven, get a hammer and chisel, try to pull them out, and they spend a lot of energy. They get burned out. They're not efficient, and they have all these regulations to deal with to pull the patient through. And a lot of times when we're in one slice, we don't know what's happening with the patient 2 slices before or 2 slices after. And so to try to align across various verticals and to be able to get to see the journey of the patient from before till post care, an entire journey, and map what is the ideal journey look like, and then see where it's going off the ideal journey and establish thresholds when it does go off the journey so it can trigger the right people at the right time. I think that was one piece. The second piece I find cool is that, we imagine the one-way mirror I talked about as a patient, family member. I don't know what happens behind, right? So as a patient, I see something and I complain. So my complaint then goes to patient experience team over a duration of time between 48 hours to 2 months, right? And then it goes from there to the physician, right? Or the physician sees it too, but it's with a time lag. And then the physician or those who provide care feel punitive, right? Bad, your scores are, But by then, what we need to do is break this glass and really allow that, because they're driven to serve. Their sense of purpose is to serve the patient. And so if the patients can express in a psychologically safe manner, and the physicians and care providers can then react quickly and respond, because we're trying to solution 2 months later without the understanding of what was going on behind the mirror. We need to enable at the same time so the people behind the mirror can comment on the situation, what was occurring, and what were causing those outcomes that the patient or family member was seeing, and try to do it at the same time. That's where the juice is. And the last piece I would say is teammate experience, patient experience, safety outcomes are connected intuitively, right? And we have various papers, but how do we see that regularly? How is it that when we're spending time at a board level or at a frontline leader level, I'm looking at both ends of the spectrum, that we're looking at it contiguously and we get it, that this all happens together. And instead of a leader having to do a survey, a teammate having to do a survey on 5 different things: compliance survey, magnet or pathways survey, teammate experience survey, clinician engagement survey, DEI survey, like we've combined it all into one. And instead of doing now 5 action plans for a leader, you can work on 1 action item, And the institutional resources, instead of them being spent on 5 different aspects, can look on 1, so that we can really zoom in, fine tune the one foundational thing that impacts the others.
And what is that one survey or that one thing look like?
So what we have recently done, I can only talk about our experience. I think everything is contextual, right? I always say data without context is like body without the soul. A body without the soul is lifeless. A soul without the body is scary. So we got to put them in context. So from our context, from our organization, what we did is we took our culture of safety survey, our DEI survey, our teammate engagement, our clinician engagement, workplace violence, compliance, put it all into one survey. And then we are looking at that information holistically. And then instead of each of these COEs or verticals going to the leader saying, hey, I need you to do X, I need you to do Y, we're looking at it holistically and saying, what is it that underpins from our data, from what our teammates told us, what are the key drivers? So you can use statistical analysis to identify the key drivers and identify one key driver that the entire organization can focus on, and 1 or 2 key successes that the entire organization can celebrate. We got to do both, and then move the needle together.
As opposed to having a bunch of different separate siloed situations going on.
Yes. And so imagine if the entire organization can focus on 1 or 2 aspects that we need to improve on. So someone may say, I'm a leader, and say, hey, I'm already in the 90th percentile. I don't want to work on X. said, no, we should work on X. Why don't you help someone in your vertical or similar business line who's on the other end of the spectrum? So that we move as an organization, because as an organization, that is foundational for us to move to the next level. Meanwhile, you can talk to your team and also see what else you could work on, right? I think that is the key. And instead of working on all those 5 different pieces, you could work on one. And the organizational resources, then that imagine the weight of the entire organization focused on 1 or 2 aspects.
That makes a lot of sense, because previously, right, every team is going to work on what they scored on, or every department's going to work on what they scored on negatively, and it might be completely different from the organization as a whole. But in this case, the organization is moving as one.
Yes, you got to do both. So one is at the organization level and one is at the team level. So as an organization, so we can lift the entire organization in the same direction, and then each team will have its nuances. So we got to have a framework and then allow for some flexibility in the framework.
Makes sense. Can we talk about how these because frameworks, right? When we talk about frameworks and we talk about organizational movement, some people might feel, a sense of rigidity or a sense of being at the macro level, but you specialize in this individualized, human-centered approach. Can you talk about how doing structured frameworks helps you to care about each individual team member or patient to such a level where they're you talk about this notion of a customized experience, right? So can you just expound on that a little bit?
Yeah. So I want to underline that we're still working on it as a team, as an organization. The foundation is being able to understand an individual and being able to understand the individual's journey and motivations, right? And then you can customize at that. So organization and then the market segments, right? And go down to the individual level. The only way we can do that at scale is to leverage data and technology and enable the humans at the point of contact to have the relevant data using the technology at the right time. Let me give you so let's talk about the framework and then an example. So the framework, for example, if you were to look at patient experience, let's take patient experience, starting from the point of I've moved to Charlotte, I need to look up, let's say I need to look up neuro, because of my stutter, I need to look up neuro services, right? So how many people in this zip code looked up neuro services? How many picked us for primary care? How many were referred to specialty in network? How many went to inpatient? How many went to rehab, hospice, and so on? Can we slice it so that we can see the entire journey? Today we can't, like we were talking about. We all can see mostly in the slices, and then not only how we can see the entire journey of the patient or the teammate, but also can understand what has been going on and what is their motivation. So I'll give you one example from without any details. So there was a patient who, it was very, very, very engaged physician who gave of themselves like I wouldn't believe, right? Amazing physician, 26, 27-year experience in a area, a clinic where people who were less fortunate lived. And he had a patient, he talked to me about, he saw the patient in an ED and then the patient passed away. And the physician was quite shook up about it. Okay. And we still stirs some emotion. And we talked about, and he's like, I don't know. I gave him the medication. He was a great patient. He understood. He was a first generation patient, an immigrant like me. And I can't understand why he wouldn't take his medication and he passed away. And then we had a conversation after a few weeks with the patient's daughter, who agreed to come and talk to the patient. And she revealed that he was a roofer. And upon discussion with the group, the nurse, we were able to understand that if he took that medication, he couldn't work because of the side effects, and that would have negatively impacted his earning and the daughter's education. So the physician was like, had I known then, maybe I would have given a medication which was less efficacy, that would have allowed, but we don't know, so we can't. So that's why it's important to be able to look at the whole person. And we talk about social determinants of health, and we talk about, but how do let's say I cannot afford 3 meals a day, would I be comfortable sharing that with someone? Will my cultural bias or my whatever mindset, right? Especially if I'm there with my daughter and she doesn't know and she doesn't live with me. I'm just making this up. Like, how do you create that psychological safe space? And that's why I talk about that. So psychological safety is something very key, is one of the key foundational things so that we can customize. Because if we can't understand, because in healthcare, the awesome thing is that everybody is driven to serve, right? They want to do the right thing. But the person on the receiving end, those we serve, whether it's our teammates we serve or our patients we serve, if they are unable to express their concerns or other aspects that we may not be aware of because they're not in a psychologically safe place, then it defeats the purpose to an extent. So that's one piece. The second piece is, at each point of the journey, your needs may be different. And so how do we customize to your needs is what we're working on.
So how do you create that psychological safe space? How are you teaching your staff to do this?
Fundamentally, we have to remove the glass. And we have to build. There are many methodologies depending upon. So psychological safety has many facets, right? There's inclusion. There's depending upon which theory you're looking at. But fundamentally, in my opinion, there are three pieces. One is, do I feel included? Do I belong? Right? I know inclusion and belonging are different, but you know what I mean, right? I'm just giving a high level oversimplification version of Vishal. Second is can I express myself, and then can I express myself without fear of retaliation? And if there is a blame, if there is a mistake, is it to learn or to blame? Like, what is the, I didn't express that right in English, but you know what I mean, right? If there's an error, are we focused on a blame culture? And so culture is foundational. And to make sure that people are able to express themselves to their leader, to senior leader, and or have 1-800 numbers or whatever, like anonymously or not. And the other thing is listening, continuous listening, and not when it's convenient for the organization. It's also when it's convenient for those we serve. So at the point, someone should be able to. So the difference between pull and push, right? So we push the surveys out, or we push saying, "Hey, how did we do?" And we ask specific questions rather than saying, "What's important to you?"
Right.
And then listen. So now technology can do that for us. And I was having a conversation with a group yesterday of us, and then like we need to rethink about our. When we have all this data, we can use a small language model or a large language model, depending upon the security that we want to deploy. And instead of asking specific questions, how did males rate us? How did females rate us? Or what, I'm just making this up. How did short people like me rate us versus tall people rate us? Whatever it is, instead of doing that, we can just try to understand what are the clusters amongst all this data. And then start looking at which clusters align with our strategic mission that we want to focus on, which where are our strengths we want to amplify, where are opportunities that either we want to address or we don't want to go after that market, or whatever the case is. We need to apply our strategic mindset, but we can look at all the data that we have and utilize a different approach rather than us asking questions. Let's see what stories the data can tell us. And now we can use AI, ML, and statistical techniques in combination to help us arrive at those insights.
And so you put all this data through an AI system, right? And then what does it exactly tell you? How much research is required after you run it through the system?
So, being honest, we're still in the process of building our frameworks.
Yep.
So, I can theorize what it can do. I've run simulations, but outside of work, but not with our data. And so, first, having a consistent, a proper framework is key. And having data which has common definitions across the continuum of care is key. Otherwise, you can build a palace on sand, it won't last long, and then you have to build another and keep going. So I think the AI frameworks are key, and below that, having translatable data with consistent definitions is key. That's where we are at right now, and we're pulling that together. That's the foundation.
So across the 6 states, you're trying to get everything in like Epic, for example, to have consistent data that an AI could be able to use.
Yes. So AI is a broad term, right? So what we want, what we're hoping to be able to do is leverage the end-to-end journey, understand the end-to-end journey of both the patient and the teammate, understand where we're going off the ideal path, and where are the choke points, whether it's time or volume or both or emotion, depending upon the experiences, and make sure we're having quick feedback times, closed loops from those we serve, those who serve, and understand where the opportunities may lie, prioritize them, and then scale them.
Last question for you, and I appreciate this is very cool technology. How scalable is this? So we look at like Kaiser Permanente, they are in California and now they're in Pennsylvania, right? So would you be able to track, for example, someone's journey across states and across different hospitals, across pharmacies, and be able to monitor their experience and then identify instantaneously where they started to have a negative experience or where they, things like you said, went off the path? Is that what the goal is?
That's the vision, the dream. I'll let you know once we get that. But in my opinion, we have the technology to be able to do that. We need to bring all the stakeholders on the same page, right? Starting with the patient and the frontline teammate. In this case that you talked about, the pharmacist, we need to have the voices at the table which are representative of those individuals. Understand what is the least friction way for them to engage in it and take ownership. Understand their pain points and how can we minimize, how can we break that glass for them so that they can get what they need quickly. Yes, we're working on that. Absolutely.
I appreciate your time, Vishal, and I hope that we can have you back on once you build this incredible system.
We're working on it. One thing I do want to say is none of this is possible without my team and the team that we have at this incredible organization. Each of us brings a different perspective, and to be able to learn together on doing things. I give you one last example, and us putting the survey together that we're talking about, all these into one survey. I said, like, how many of us remember learning to ride a bike? Right? We fell a few times, I'm sure. When I broke an ankle when I was learning to ride a bike. You know those bikes that have like 5 or 6 seats on it?
Yeah.
We have decided that we're going to learn on that bike,
Oh.
right?
Yeah.
And why? Because we can pedal together. We will go faster than someone on a single bike. And when one is tired, another can pick up the speed. And we're headed in the same direction, most importantly. Right? And we've done that now. We haven't broken any bones. So we're moving in the right direction. Uh, and it takes everybody on that team to give up a little bit something. Because someone may want to go left to see the pond, someone may want to go right because they saw a bird, but we're on the same. We're giving up some of our personal slant so that we're together. So that's so key and foundationally important to collaborate.
That's a very, very impactful illustration from some things that I'm experiencing as well, where a lot of our wonderful teammates, especially in volunteer organizations, sometimes we have all these different ideas that we're excited about, but I like that a lot. So I really appreciate that. And thank you for your time. I know it's during lunch hour there, and so I do really appreciate you sharing, 40 minutes with me to talk about this. It's been very impactful for me, and I'm sure our audience will enjoy it as well.
Thank you so much, Cole, for the opportunity.